I'm Kimberly Tumlin, and this research brief will address the paper that we recently published in Behavioral Sciences titled Lower Emotional Exhaustion Among Employees is Associated with Intentional Incorporation of Animals into Residential Care Settings. Residential care center staff are extremely important care system workers, and we know that emotional exhaustion is a core dimension of burnout. And burnout has been recognized as a psychosocial syndrome that affects workers. We also know that turnover rates can be as high as 25% in residential care center staff. We also know that organizational level practices shape safety cultures. And so we need to look at clinical strategies which increase treatment effectiveness within residential care centers. And this includes those animal-assisted therapies that are being used. But we haven't ever looked at whether or not the presence of animals are impacting emotional exhaustion as a core dimension of burnout in the residential care center staff. So our purpose in this particular paper was to establish just a baseline organizational cultural perceptions of workers that are going to aid in us contextualizing future studies on worker wellness programs. And our second purpose was to actually determine relationships between organizational cultural constructs and intentional incorporation of animals into the therapeutic milieu. Now, intentionality in here is important. We are actually going to break our respondents organizationally into three groups: those that don't incorporate animals, those that incorporate animals but incidentally, and those that intentionally are using animals for therapeutic gains for the youth that are in their services. Our hypothesis for this study was that intentional incorporation of animals into the therapeutic milieu would be positively associated with organizational cultural constructs. We also had a sub-hypothesis that child characteristics, caseloads, and worker tenure would actually impact our model and depress or decrease what these positive impacts of animals might be. Now, our population that we used in this study consisted of 213 residential care workers. This represented 16 different residential care centers locations within the United States. Our data sources consisted of two sources. First, a quality improvement survey, which had these organizational cultural constructs, and then 2 years of administrative data about youth that are in services at these specific residential care centers. Now, our key predictor in this study was actually animals and incorporation of animals. So 77% of the responses in the survey actually said that animals were used incidentally within their organization. And 51% actually reported that animals were used intentionally in caseloads or addressing youth conditions using animals therapeutically. So to just quickly look at some of the results, we have both worker data and child data that were significant within the models that we ran. So we see that emotional exhaustion in this dark gray bar and also psychological safety constructs were significantly different based on type of organization that existed, whether it was one with incidental animal use or one with use of animals in the care plans intentionally for therapeutic gains. And we see that emotional exhaustion was actually the lowest in those organizations with intentional use of animals. Now, as part of our sub-hypothesis, we thought that the child data would actually impact and the tenure of the workers would impact whether or not these significant differences in organizational cultural constructs would remain. And so what we see, first of all, is looking at the number of youth with trauma-specific items of ever neglect, of ever having detention, or ever witness to family violence. We actually see that we have these trauma-specific items very clearly delineated across the different organizations. And we thought that actually this would impact our model. However, when we adjusted for work stress factors, including child trauma that we just looked at in the last slide, and intentional and also tenure of those workers at that particular organization, intentional incorporation of animals decreased emotional exhaustion of those residential care center employees. We also saw approximately a twofold increase in workplace safety constructs and a threefold increase in psychological safety constructs. Now, this is really exciting because organizational cultures which intentionally incorporate animals appear to be supporting safety culture habits as well. So, to the best of our knowledge, this is the first study to also report on how animals and the intentionality of animal incorporation is related to organizational culture constructs of psychological safety and emotional exhaustion. Use of animals in the workplace definitely provides an encouraging strategy for improving components of burnout syndrome in residential care system workers. Thank you so much. My contact information can be found here in the QR code, and complete copy of the paper in the QR code in the upper right.